Good evening. Welcome to Training Tuesday. I am Bill Brown, the Director of New Faith Expressions, and with my colleague, Reverend Dr. Rodney Smothers, we are always excited to bring you a Training Tuesday, and tonight is a particularly pertinent conversation as we discuss and give updates on the Re-Entering Well Task Force from our annual conference. Before we begin, just a couple of technical, let me take care of that. Technical items. If you have a question, please use the Q&A feature. You do not need to raise your hand. Also, the chat is not available for you to communicate, but please open your chat because throughout the evening, we will be sending messages and links so that you can stay updated with the latest information that our conference task force has put together. Before we begin with prayer, let me introduce our conference task force, and I will just go around as I see them on my screen. Of course, we are joined 2 weeks in a row by our bishop, Bishop Easterling. Welcome. Thank you for joining us again this week. With the bishop is our Director of Communication, Melissa Lauber, our Assistant to the Bishop, Tony Love, our Chief Financial Officer, Paul Eichelberger, our Director of Human Resources, Francis Tego, our Director of Connectional Ministry, Christy Latona, and our personal consultant around all things medical. I'll come up with a title by the end of the evening, but Ella Curry, it is good to have you with us tonight. This team, in addition to our Dean of the Cabinet, Reverend Rebecca Inaselli, makes up the COVID task force for the annual conference, and they have been meeting throughout the year, helping to shape our response and to make sure that we are definitely privileging people over everything else. So it is a joy to have them join us tonight. And if you would all join me as we open with a word of prayer. Holy and gracious God, I give you thanks for the leadership within our annual conference, those who are visible on our panel tonight and those who are participating as attendees, for they have been navigating such difficult waters, but you have been guiding them, oh God. You have been guiding all of us as we have moved through this time of pandemic and as we've had to pivot and shift and do things we never thought we'd have to do. But you've been the God of it all. So as we are on the cusp of moving through these stages and steps of the pandemic, it is easy for us to want to go back to Egypt and to go back to what was comfortable and go back to what we thought was normal, but we are moving forward, oh God. And so we are moving forward into the land which you have prepared for us. And we give you thanks for these, our servants on the COVID task force, who are showing us the way as we continue to want to re-enter well. We pray for your Spirit to be on all of us in the name of Jesus. Amen. And without any further ado, I'm going to welcome and invite our bishop to get us started. And I'm going to go do my tech thing.
Thank you, Bill. As always, you start us well. Beloved, thank you for being here. As we begin to reemerge from the grief, caution, and anxiety after more than a year of physical distancing, it is important to pause for a moment of recognition and reflection. We thank God for the people of the Baltimore-Washington Conference and for the leaders of its churches who have responded in unprecedented ways to ensure that the body of Christ continued to be strong and vibrant throughout the COVID-19 pandemic. During this quadrennium, we have been guided by the wisdom and teachings of Ephesians chapter 4, verses 1 through 16. We have drawn from these passages as we engaged in holy conferencing, developed our strategic foci, and ordered our lives together in mission and ministry. The overarching message inherent in these verses continues to ground our protocol and our processes for gathering together as the beloved community. Ephesians reminds us that we are one as the body of Christ, and within that oneness, there is yet diversity. The way that we are able to remain in the unity and bond of peace is that we privilege others above ourselves and care for one another with acts of love. We also resist any immaturity that tears at the fabric of our unity or succumbs to selfish motivations. We bear with one another in love as we all strive toward the same end, which is being fully alive in Christ and robust in love. As your Episcopal servant leader in consultation and conversation with this, your COVID-19 task force, we have stressed to you that we must privilege life over every other consideration. During the early stages of the pandemic, we erred on the side of safety rather than expediency, and worked to be nimble and flexible in all that we did, trusting in the best information available to us from our medical experts and infectious disease personnel. Our personal desires were secondary as we sought to care for the most vulnerable among us. Those principles have served us well and will continue to guide us as we begin to reopen our church buildings for worship, meetings, and other in-person gatherings. In this time of transition, beloved, the discernment of local church leaders is more important than ever. May we continue to hold one another in prayer as we move forward in hope, grace, and love, seeking to live as the people of God, always making disciples of Jesus Christ for the transformation of the world. And now I turn to Christy Latona, who will revisit for us our Reentry Well materials.
Thank you, Bishop Easterling, for your leadership and for the leadership of my fellow task force members. If your church doesn't have a Reentering Well task force, please start one. This task force is responsible for discerning how policies, practices, and procedures based on your context and the best information available should play out in your local church. For those of you who have one, thank you. I know you have made some very difficult decisions and you have really taken the time to discern, not just decide, but to discern what God is calling you to do in the midst of this pandemic. This team is critical not just for the first decision about how to re-enter your building for worship, meetings, and other in-person gatherings and ministries, but also for ongoing adjustments and pivots as we move beyond the phases and into a world of vaccination accessibility. On the next slide, you'll see some of the new resources that we have up on the bwcumc.org reentry page. There's an updated 6-page guideline document, and we've developed 2 new resources to help equip your local reentry task forces to choose safer activities and to make decisions about whether or not to require masks as federal, state, and local mandates are being lifted. Let's briefly review one of these resources now. On May 13th, you all know the CDC stated that fully vaccinated people no longer need to wear a mask or to physically distance in any setting except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. That means that each reentry task force can decide whether to require masks on church premises based on its values, such as hospitality and concern for vulnerable church members and others in the community. Additionally, Reentering Well task forces are asked to consider how their church can help people get vaccinated. I would like to ask our task force's medical expert, Ella Curry, to say a word about vaccination.
Thank you, Christy. Vaccination is a public health imperative. In other words, it is an essential or urgent thing to do in the time of pandemic. Efforts to encourage and promote uptake of vaccine supports the common good. Our human nature is one of freedom and independence. But when we decide to live in community with other people, be that as a family, a town, a county, a state, or a nation, we do so with an eye toward creating community and assuming responsibilities that benefit the common good of the community's members and to best care for the most vulnerable among us. We recognize that approach in various aspects of our lives together. In public safety, things such as stoplights, sidewalks, crossing guards, fire and police departments. In public health, clean water, departments of health, food safety, contact tracing. In mass transit, things like buses and subways and bicycle lanes. And public education, schools, Head Start programs, public libraries. COVID-19 testing and vaccinations are among public health provisions that contribute to the common good. But vaccination is also a very personal health decision. However, it involves information gathering and decision-making that are familiar to all of us. Every time that we talk with a healthcare provider, a family member, our pastor, or a good friend about the risks and benefits of surgery, radiation, chemotherapy for something such as cancer, or the trade-offs between established medications or experimental new ones, or alternative therapies instead of drugs or surgery. We recognize that personal healthcare decisions are complicated and challenging. But we are required to have these discussions and to make these important decisions all throughout our lives. And we can do the very same thing with regards to the coronavirus vaccine. I welcome back Bishop Easterling to talk about the current state of the virus.
Thank you so much, Ella. It is important for us to remember that we have not fully emerged from the COVID-19 pandemic. Although the numbers have reduced, we are still seeing new infections and deaths attributable to the virus. However, with the number of persons who are now fully vaccinated, and fully vaccinated is defined as being 2 weeks post your second dose of the Moderna or Pfizer vaccine, or 2 weeks post the 1 dose of the Johnson & Johnson vaccine, state and district guidelines have significantly changed. As of June 11th, there will no longer be any gathering restrictions for places of worship or mask requirements for fully vaccinated individuals in West Virginia, Maryland, or the District of Columbia. I want to repeat that. As of June 11th, 2021, there will no longer be any gathering restrictions for places of worship or mask requirements for fully vaccinated individuals in West Virginia, Maryland, or the District of Columbia. The restrictions on gatherings and mask mandates are now at the county or local entity level. This is why it is imperative that each church have a reentry well task force, and that said task force remains aware of the local requirements, and that they use the information we are providing to make their own decisions concerning reentry. Beloved, we are well aware that some congregations or individuals would like to see the conference provide concrete guidance on matters such as showing vaccination cards or wearing masks. However, a one-size-fits-all approach is neither feasible nor appropriate. Each task force will have to consider the demographics of your congregation and constituents, the risks to all persons involved, both directly and indirectly, and the requirements of your local governments in making your decisions. The safety measures that have always been in place to limit transmission of the virus remain unchanged for unvaccinated individuals. The safety measures that have always been in place to limit transmission of the virus remain unchanged for unvaccinated individuals. It is without question that these safety measures have significantly reduced transmission of the virus and saved lives. Therefore, it is prudent to continue implementing those practices as we continue to privilege life and health above every consideration. The virus that causes COVID-19 can land on surfaces. It is possible for people to become infected if they touch those surfaces and then touch their nose, mouth, or eyes. Now, in most situations, the risk of infection from touching a surface is low. And we know the most reliable way to prevent infection from surfaces is to regularly wash hands or use hand sanitizer. Therefore, we encourage congregations to ensure that they have adequate supplies of hand sanitizer and hand soap on hand. Although we just articulated that the likelihood of transmitting the virus from surface contact is low, cleaning and disinfecting surfaces does reduce the risk. Those responsible for cleaning should use reasonable measures to keep surfaces as clean as possible. Contact tracing is still a part of the strategy to curb the spread of the virus. Should any individual who has been in attendance at a gathering be diagnosed with COVID-19, all those who had close contact with that individual must still be notified. Close contact is defined as having been within 6 feet of that individual for 15 minutes or longer. I'll say again, close contact is defined as having been within 6 feet of that individual for 15 minutes or longer. For individuals who have been fully vaccinated and are not otherwise immunocompromised, the list of activities that pose a risk to their health has been reduced to 0. As you can see from the graphic on the screen, individuals who have been fully vaccinated may participate in indoor activities of all gathering sizes and with no known risk. They may likewise participate in indoor activities of all gathering sizes, again, with no known risk. For individuals who are not vaccinated or who are vaccinated but are immunocompromised, there remain varying levels of safety with respect to certain activities. As the graphic before you demonstrates, individuals who are not vaccinated are least safe when they are indoors without the ability to physically distance, or participating in activities where materials are being shared or where droplets are being produced at a more robust rate, such as congregational singing. The risk decreases for unvaccinated individuals where the gathering size allows for physical distancing or the activity occurs outdoors. The best medical information informs us that vaccinated individuals are highly unlikely to transmit the virus to unvaccinated persons. Therefore, for unvaccinated persons, the highest degree of safety exists when they are outdoors in a small group of persons who are fully vaccinated. With respect to mask wearing, the CDC encourages all individuals who have not been vaccinated to continue wearing a mask unless, again, you are in the aforementioned activity. But even in this limited instance, we encourage unvaccinated persons to be very careful. Why do I say that? Because although we presume that individuals who report as fully vaccinated are indeed in that category, there is absolutely no way to definitively ensure that persons are indeed fully vaccinated. Please be reminded that we are not developing a threshold of safety in these materials. Rather, we continue to articulate that nothing has changed for unvaccinated individuals. All precautions, protocols, and procedures remain in place for individuals who have not yet been vaccinated. I now turn to Reverend Tony Love, who will address how we move safely forward together.
Thank you, Bishop Easterling. How do we move forward? Rhythmically move forward together. As we consider worshiping together, let us look at the guidelines that have been provided. For indoor worship, fully vaccinated persons no longer have to wear a mask, nor do they have to maintain physical distancing of 6 feet in any setting, except where a federal or state or local rule or regulation, or there's a requirement by a local business or workplace or church. Indoor worship for those not fully vaccinated requires persons to continue with all protocols and practices to protect themselves and others, as well as to prevent the spread. So we would invite those persons to continue to wear a mask that covers their nose and mouth, to stay 6 feet apart, maintaining physical distancing, to avoid crowds and poorly ventilated spaces and places, wash hands often and frequently, as well as use hand sanitizer. In regards to outdoor worship, fully vaccinated persons are able to gather outside without masks, without maintaining 6 feet of physical distancing, except certainly where laws or rules, regulations, or requirements prohibit. Outdoor worship for persons not fully vaccinated still requires persons to continue with protocols and practices to protect themselves and others and prevent the spread. These persons are asked to wear masks, maintain 6 feet of physical distancing, avoid crowds, wash hands, and use hand sanitizer. While indoor and outdoor activities to include worship pose minimal risk to fully vaccinated persons, we want to be a community that cares about and cares for all persons. So let's talk about hybrid worship, where there is in-person worship and there's online worship. Hybrid worship offers the option to persons to select that which seems best or suitable to them based upon their vaccination status, preferences, or other factors and considerations. Hybrid worship provides an opportunity to care for the most vulnerable among us. Hybrid worship continues to provide worship to those who cannot join us at all, as well as offer a worship experience to a larger and broader audience. Some may be asking, well, can we go back to singing? Can we take communion? Can we put our hymnals back in the pews? Let us remember, our safe practices and protocols are still in place. The only change has been the lifting of requirements such as masks and physical distancing, the frequency of washing of hands and using hand sanitizer, certainly for the fully vaccinated persons, that they are able to re-engage as prior to the pandemic. And still though, as a community, we want to be caring for those who are not vaccinated. While we have been talking about worship, there are other ways in which we gather beyond worship in our buildings. We gather for worship, but we are also in there for meetings, to care for mission and ministry, but also there's building usage. And in all of these times of gathering, the guidance that has been provided this evening, we're asking that it be considered and it certainly be applied. I thank you. I'll now place you in the hands of our Human Resource Director, Francis Tago.
Thank you, Tony. How do we move forward as we continue to privilege life and health over other considerations. In these challenging times, we are called to find new ways to be a community of love, to encounter Christ and engage the world. But the safety and health of every person is our priority. We think about what considerations are available for pastors with health complications, pre-existing conditions, who either cannot be vaccinated or who remain at risk after vaccinations. Getting a COVID-19 can help protect you and others around you from contracting COVID-19, particularly people who are at risk of severe illness. For the CDC, vaccines are especially critical for people with certain health conditions. However, we know for the CDC that there are some people who are immunocompromised and cannot be vaccinated, or who remain at risk after vaccinations. We do encourage those who have not yet been vaccinated or who are considered vulnerable to the virus to continue following all pre-COVID-19 vaccine guidelines. For clergy who do not plan on getting a vaccine, if there are any, we strongly encourage you to speak to your SPRC and your re-entry task force about how they can best accommodate your safety in the church, as well as the safety of the congregation and staff. All persons are free to continue wearing masks as long as they like, and we encourage congregations to show respect to those who continue to wear a face mask and practice physical distancing, regardless of their vaccination status. For HealthFlex participants, testing and treatment for COVID will continue to be covered in full through July 19. MD Live telemedicine will also be covered in full through July 19. If you are feeling any anxiety, pressure, or complicated emotions, please make use of the Employee Assistance Program. Participants received 8 free in-person or virtual visits for separate issues. You may have seen COVID-19 tips through your Virgin Pulse app or heard from your health coach. One of the cards I can tell you today, when I went into my Virgin Pulse, it gave me 3 tips to reduce stress. And one of the 3 of them says, manage your physical health by getting enough exercise and sleep. Nurture your emotional health with the support of friends and family. Write your worries down instead of constantly thinking about them. So if you have not yet created a Virgin Pulse account, please do so. The health information that used to be found on your HealthFlex WebMD portal will now be found in the Virgin Pulse app. For more information, please contact the benefits office. For our preschool centers in United Methodist churches, there are guidelines on the CDC, state, and county website that outlines strategies that can be used to maintain healthy environments and operations. How to work together to share best practices. If your church has a plan that is working, please share that information with our communications department so it can be included in the weekly e-connection email for all to benefit from. We are all in this together. Communication is key. Continue to distribute important information to your congregation. The BWC echoes Governor Hogan's quote, which reads, I know that there is a lot of anxiety out there and a lot of stress. Folks are worried about what lies ahead and how we're going to get through this. We're all worried about our family members and our loved ones, about our communities and neighbors. But I want everyone in Maryland to know that if we continue to lead, we continue to work together. And if we rely on and help each other, we will get through this crisis. End of quote. And I'm sure the leaders of the District of Columbia and the state of West Virginia concurs. Widespread vaccination is a critical tool to help stop the pandemic. Get your COVID-19 vaccine as soon as you possibly can. There are many clinics in our area where you can just walk in. On a final note, making efforts to be well and stay well is more important than ever, and we are here to help. Thank you. I'll now turn over to Eller, who will continue with the risk of the vaccine.
Thank you, Frances. So I'm going to address a number of risks that have been raised in messages to our committee, and we'll also continue to do that throughout the program in the question and answer period. One of the things that I wanted to highlight is that the greatest risk that we're all responsible for knowing about and caring for at this point are the risks for the most vulnerable among us. And the risks, those would include our children under the ages of 12, and then any child, young adult, or senior who have chronic medical illnesses, or perhaps are under treatment that cause an immune compromise. And for some of these folks, even having been vaccinated, they are not fully protected because of the immune suppression and their response to the vaccine. So in that regard, we want to be very mindful of who these folks are in our communities and among those for whom we're making decisions as we make plans for reopening our churches. Another thing that I want to mention and follow up to what Frances said about being mindful of language. Let's remember that we're not just lining up and comparing the vaccinated and the unvaccinated. We're talking about human beings, our friends and families and coworkers, neighbors, our leaders, who either have or have not had the chance to get the vaccine, or perhaps have chosen not to get the vaccine. But we don't want to render anyone into any category of aspersion that would make in any way diminishing their humanity or the decision-making process that is underway for them. Now, mentioning in particular among our most vulnerable, I said children under the ages of 12. And all of you are aware, I'm sure, that they are not yet available or eligible for vaccines. Probably sometime in the fall, we'll be seeing that change, but at least for most of our summer programming, what we'll need to be doing, because they are not eligible for protections that others are, is that when we think about Vacation Bible School or children's church or childcare, that we need to continue to practice under the guidelines, policies, and procedures that we have for the last year with regards to anyone who has not yet had the opportunity to be vaccinated. So again, for children in Vacation Bible School, children's church, or childcare, we will continue to follow the same guidelines that we did last summer and throughout this year, always in the interest of protecting them until they have the option for another layer of protection through a vaccine. We've also had questions about asking someone about their vaccine status. And a question that has come up several times is it a violation of HIPAA to ask someone about their vaccination status? HIPAA, which stands for the Health Insurance Portability and Accountability Act, that was enacted in 1996 and revised in 2009. does not apply at all to, in this situation, in churches. The act itself was designed for third-party individuals within the healthcare industry, in aspects anywhere from healthcare providers to hospitals, clinics, as well as to health insurance companies, to prevent any disclosure of private health information about anyone without their consent. So that is what HIPAA covers, and therefore does not apply to a church. Does that mean that there is not responsibility that will attach if you are inquiring about someone's vaccine status? Then those are things that we need to be thinking about and talking about. If there is any indication that there are churches that want to make that move, we are not endorsing that. We're not forwarding any decision-making around that, but one must be mindful that even if you were to develop a plan that was agreeable to your entire church, that means that that information goes no further. It is then your responsibility to protect that and to develop programming around that. So I think at this point, we'll move to our first question and answer period that'll be managed by Bill Brown.
Thank you, Ella. Thank you to the team. You have, I'm going through the questions, and each time I'm ready to say, oh, we'll ask this one, you've answered it. So we've been able to check that off. But one that has come up is what, I'll just ask the question the way the writer presented it. What do we need to do to safely re-water our water fountains? I guess the question is, when can we turn on public water fountains again? And I'm gonna see if Ella can answer that question.
Yes, I would like for Ella to first address that if possible.
What I would bear in mind is that you would want to treat water fountains as you have before, with now the proviso that vaccinated individuals could in fact use the water fountain in that setting. But people who have not yet been vaccinated should not be using those water fountains while they're in the church building for any occasion.
And as we think about that, I think we have to be reminded, as Ella has so appropriately guided us, persons under 12 are not yet eligible for a vaccine. And unless someone is going to stand there and monitor that water fountain, they might be drawn to it. They might be drawn to use that fountain. And we know that they would then be put at risk. Those are the kinds of things that the task force has to think through as they're deciding when to reenter, how to reenter, and how to begin to use common areas in the facility again.
I would thank you, Bishop, because I would say it would be easy for us to be participating in this webinar and want to have all the questions answered for us. And these are just stepping off points is what I'm hearing for individual church teams to begin wrestling with it in their particular context. Because I believe, as you said from the very beginning, there is no one size fits all for the entire annual conference. But a number of questions have come up about children's ministry. And they want just some clarification about volunteers who are working with unvaccinated children and mask wearing. And what are the guidances? What is the guidance for that, or where should they turn to find further guidance?
I believe Christy has posted in the chat, so you'll want us to go through there and look. I'm pretty sure, Christy, that you posted the guidelines from the CDC around children and childcare. Is that right? Okay. And then with regards to volunteers, once again, we're going to need to consider who has received a vaccine and who has not. Bear in mind always that someone who is without a vaccine, it creates risk for anyone else who is without a vaccine. Okay, so let me just say that again. It's people who have not yet received a vaccine for any reason, be it age or medical conditions, are at greatest risk to each other in terms of transmitting the virus, because they're on that continuum of where we've been for the past year until we had vaccines available. So, for instance, a vaccinated person could volunteer with children and not have to wear a mask. But one thing that I do want to let you know that I've learned from our colleagues in retreat and camping ministry, that when we have the care and custody of children and providing ministry with and for them, we're often modeling behaviors for them. And inasmuch, there are many aspects of camping ministry, for instance, where the adults, even if fully protected, will continue to wear masks in settings with children of an age who need to continue to wear their masks.
So a number of questions. I know you've addressed it throughout the evening, different panelists, but people are asking, I guess, for a little more clarification. First, around congregational singing. When is it safe for congregations to sing together again?
I hate to wear Ella out on our panel this evening, but as our infectious disease specialist, I think she can offer the most informed answer. I would just be reminded that, as we've said over and over again, if a person is not vaccinated, the risk level for them has not changed. And all of the protocols remain in place for those individuals. So prior to vaccines being available, we had guided that there should be no congregational singing. And so I just keep that before us, but I'll turn to Ella if she has any additional guidance on that.
No, that's exactly right. And so I think even when you refer to the chart that both Christy and Tony used earlier in their presentation, that will also be among the resources you find on the BWC website, that you'll see that essentially vaccinated individuals in a church that is open for in-person worship and based on what decisions they've made for themselves with their reentry task force at the local level, that people who are vaccinated and do not have to wear a mask can sing along with the music. If you have guest soloists or guest musicians who have also received the vaccine, they will be performing unmasked. But people who have not yet received a vaccine will continue to wear a mask and should not be participating in singing.
If I could have a follow-up question to that for Ella, I'm not sure that we've said it expressly, so I'd like to ask you. With the current medical information and scientific understanding that we have at this moment, what risk do vaccinated persons pose to unvaccinated persons? So you just talked about a guest soloist who we believe to be vaccinated singing. Do they pose any risk to persons who are unvaccinated in the congregation?
This is something that is developing science. You may remember, probably back in March into April, as more people were getting vaccinated, we were still in a very cautious position around that I, as a vaccinated person, could still be exposed to the coronavirus and carry it and potentially pass it on to someone else. The science is evolving and we'll continue to hear more about this. So no one is saying absolute zero risk at this point, but what we know is that the virus, that once you're vaccinated and your immunity, you've gone past those 2 weeks of your last vaccine, then we know that your immune system, when exposed to the coronavirus, is going to be responding to that virus. And inasmuch, part of the reason you then don't go on to become ill is that that virus cannot take hold and then replicate over and over and over again as it does for someone who's unprotected. So there's increasingly an idea that we probably are not going to be passing along much virus once we're vaccinated. But again, none of that is zero risk yet, but that is the wisdom of the last couple of weeks.
And what I'm going to stick with Ella on this next question. What are your thoughts? What is your guidance around celebrating communion together? That question has come up a number of times.
Okay. So you'll tire of hearing this, but you will make that decision in your own context. But bear in mind what you've been doing. Let's say that I know there are churches that have been gathering, but let's say that if you're aware that there are people who are vaccinated within your congregation and people who are not, then there are various approaches you may want to take to communion. One may be that you would want to, for those who do not have to mask and can fully participate, you may want to serve communion within that setting. But for people who are not yet protected and vaccinated and are there in your presence, masked, and still living under the guidelines that we've had for the last year, they should still be provided the portable, disposable communion sets that I know many churches have been using. And then they will take that with them as they have before and partake of that in a private situation where no one would be at risk for their unmasking and taking in the elements from communion.
That leads into a question that has been asked, or a question statement, and I'll leave it up to the panel to see who will address this. So there is a concern about moving forward with some activities that only vaccinated individuals may safely participate in, such as singing groups or praise team. Does this create classes of people, an us-them environment?
So I think that depends upon how we approach it. The way that we share the information, the way that we explain the risks to individuals, and the philosophy that we encourage for the congregation to have. We've said throughout this presentation that we must be concerned and care for the most vulnerable among us. So if what we're doing is always to make sure that we're caring for that population, there really is no us and them, because we're going to engage in the least risky behavior. We're going to be as risk averse as we can. We absolutely do not want individuals to feel like second-class citizens. We're certainly not attempting to shame anyone. Again, we've talked about several reasons why someone either has not is not eligible for the vaccine, or may have a condition that prevents them from taking it, or has been vaccinated and is still immunocompromised. So again, the way that we approach this, if we approach it from our Ephesians text, out of love, out of caring for everyone, out of wanting to move rhythmically together, then the ethos, the atmosphere that we're setting does not lend itself to us, them, or lesser than.
Thank you, Bishop.
And Bill, if I could just add, thank you, Bishop. That was, yes, thank you. What I would like to add is that we're in an important transition time in the pandemic right now. We are not post-pandemic. That is yet to come, but we're in a transition where, much as when we moved from having nothing but our safety precautions to rely on, and then we had options for testing, that was a transition. And now we have options for vaccines for most, but not all. That is a transition. But as things open up, we need to recognize that we're carrying all of our experience of the last 14 or 15 months with us into this moment. And while there were those who were celebratory at some of the opportunities that came with the most recent CDC guidelines, with that is also going to be some hesitation. And even for myself, I will tell you that as a fully vaccinated person, I am not yet fully prepared to relinquish my mask in every situation. And that's just going to take some time, because as much as it took time to get used to that mask, it's going to take some time for me to not have it as part of my sense of security and safety being in different situations. And the same thing really very much applies to our community of faiths and our local congregations. We know each other well, we welcome new people into our midst, but we need to always have front and center that we've gone through a very, very challenging, difficult time, as Bishop said earlier, that's marked by loss and grief and anxiety sustained. And also we face uncertain times, economically and many other ways. So one, we don't know what it means if someone enters our sanctuary with a mask on. I may choose to do that if I visit you for my own personal reasons, but we don't want to make any judgments about who is or is not mask wearing. And we definitely never want to create an atmosphere of inhospitality, because there are so many things that we don't know about each other and what each of us have gone through. And we want to always err on the side of grace and charity and openness, to be present and loving in our own communities.
Thank you, Ella. Few more questions, and before we move to Paul, what are the thoughts about taking temperature? Some churches have done temperature checks as people have come in. Is that still recommended, suggested? What are your thoughts on that? I'm going to go with Ella. Sounds like a medical question.
I will tell you, in my own health experience in the last 3 weeks, fewer and fewer places are taking temperatures. And I'm talking about medical facilities that were always taking temperatures. Now, I did go into one public setting that was to meet some people for dinner. And interestingly, that restaurant was taking temperatures, but I have not had that experience anywhere else. So what I would say is, we still know that, there are some things you can learn from taking a temperature. We always want to be clear about that. That if someone were over 100.5 when you took their temperature, then I think if that's part of your welcome and understanding into your church, the temperatures will be taken. And if your temperature is above so-and-so, you would not stay for that service. You don't want to surprise people with things like that. But if you make that all part of your reentry plan, you could certainly do that. But I will tell you, increasingly, we are not seeing it. And part of that is because, as there are many people we know that are never symptomatic and are infected with COVID, there are some people who never mount a temperature, and people who are immune compromised often don't mount fevers. So we just need to be always clear about why we're doing what we're doing, and does it serve a greater purpose? And if so, are people, by virtue of signage or communication, as was said earlier, communication's key around that if you come into this setting, your temperature is taken, and if it meets criteria, you will be asked to leave.
Thank you, Ella. Last question, and we'll move to Paul. Question on cleaning. Several questions came in. How often should facilities be cleaned? Should they still be using professional cleaners and fumigating services, or can churches move back to having their previous cleaners, whether it's a person on staff or their regular company who is not the higher level of cleaning services? What are thoughts on that?
So I think that again, our understanding has evolved around how long the droplets are infectious on surfaces, that the CDC has said that we don't necessarily need to engage in the high level kinds of industrial cleaning after each, person has come in contact with the surface necessarily as we thought at one point. In my introduction, I talked about using reasonable cleaning methods to keep surfaces as clean as possible. Again, we know what's most important is that if you have come in contact with the surface, use your hand sanitizer, wash your hands after that contact. But I think the notion of a church bearing the cost of very expensive industrial cleaners almost every day or on some heightened basis is not necessarily what we would recommend at this point. Reasonable cleaning at a reasonable interval, along with encouraging people to wash their hands and use hand sanitizer, should provide a safety net for people entering that space.
Thank you so much, Bishop. And for those who are interested, Christy has placed in the chat a link for the CDC's revised cleaning guidelines if you want some more more detailed questions. And one, I was told one last question. I've got to find it because there are a lot of questions and a lot of thank yous. So for the panelists, you're getting a lot of thank yous in the Q&A as well. And as soon as I find it, we'll come back to it in our next set of Q&As. That'll give me a chance as Paul is going to share his expertise on financials.
Hey, thank you very much, Bill. We're going to change gears just a little bit as we take a look through and bring before you tonight the statistics that kind of summarize how churches weathered 2020 and kept their financial house in order. It's kind of an interesting view. It was all part of the preparation for the CFA as they've been looking at the needs to make any adjustments to the budget. And Bill, if we were to show the statistics, I think it's interesting to have a group like this to understand how churches compared to each other as they were weathering 2020. And I bring before you two columns. The 2020 income is on the left and the 2020 expenses on the right. And as I look down through the income side of the house, we saw that the tithes and offerings were down $6 million total for all of our churches. That's 6% year over year. But that was interesting to see that that was made up by the PPP funding that churches received, 6.2 million to the up. So if you were to just look at tithes and PPP funding, you would think that our churches may have done quite well to weather the storm. However, when a church has a characteristic of using a lot of building use income for supporting their ministries, as well as fundraisers, we saw significant declines in those two income areas, 34% in building use, 41% in fundraising. Overall, then, for total income for churches was down 6 million. And this makes it a very pessimistic picture at that point. However, every church knows that there were expense reductions that were done last year, and it's really intriguing to see that the total expenses of the conference went down by 19.2 million in the bottom of the right-hand column. 19.2 million, a lot of that in operating program, staff, and reimbursables. However, there were also expense reductions in that we had a philosophy of do your best for mission shares. Do your best mission shares came in 1.3 million less than budget. So that's part of the expense reductions. There were offers by the Board of Pensions to pay for 3 months worth of the pension and benefits for churches, and also gave small church grants. Those were also aspects of the expense reduction that was 19.2 million. When you compare the expenses to the income total, you see that we improved the gains of the conference this last year by $13 million. It was down by 3 million in 2019 on a total income versus expense, down 3 million. And so this 13 million better than the year prior actually ended up with a net gain for churches of $10 million in 2020. And is that type of substance substantive change in churches' operational costs. And when we added that onto any investment gains that were happening to invested reserves in 2020, we saw churches in a different place in December last year. And that is a big reason why we saw admission shares go up so great in the last 2 months of the year. And it's carried into the 2021 season. However, we still know that those churches that are fundamentally based on building use income and fundraising still have shortfalls that they are dealing with. So Bill, the question for tonight is, are there any other available financial assistances? So that's my next slide. So we're going to go through 4 areas. We're going to go quickly through the first 3 because we're going to go from low probability of assistance to high probability of assistance. The first one we're going to do is Paycheck Protection Program. So Bill, let's go through these rather quickly. First note is with PPP funding. For those who are tracking this closely, it was extended to May 31st of 2021, just coming up in a couple of days. However, on May 4th, the Small Business Administration came out with a notice and says, even though they extended it to May 31st, the money ran out on May 4th. So that is no longer an opportunity. Some lenders are taking your name so that if there were additional funds put into PPP, they might take your name. Not many banks, though, are taking those types of interaction at this point. So let's go to the second opportunity. Second opportunity is a continuation of what the conference offered from the Congregational Development Office, the tech grants. Tech grants were being used last year and they continue to be, we're receiving applications this year. It's up to $1,000 per church. If you received one last year, you don't get one this year. So you're tapped out after you get one, but we are allowing these grants to be used for any expenses that were incurred last year during the pandemic or this year as you continue to think about tech needs in the church going forward. Can be used for anything that was a prior purchase or a new purchase. And the examples are listed below we had churches who spent some on manpower to be able to staff online services, taping of services, video editing of services. Some people bought new equipment for online services. We had some people do online giving portals with these grants. Zoom licenses were a common area, as well as training. So those continue to be opportunities for churches. The next category we have. This is a little bit of what the stewardship committees have been working on for the conference to allow, because we still feel this tension in the finances, we wanted to have a backstop put into 2021, and these are the significant backstops that we have. The first one is from CFA. CFA approved a designation of $328,000 that is managed through the cabinet, and it's in support of congregations that are at risk. And in our conversation with the cabinet, we would find that the churches who find themselves in that area are primarily what we mentioned before, those who are reliant a lot on building income for making their ministry, for supporting their ministry budgets. So that's $328,000. That continues to be a good resource. That's accessed through your district superintendents. The CFA is also working with our camps as we try to put the camps fully open this year. That means fully staffed. That might mean that they're going to actually lose money this year. The net loss on camping last year in 2020 was $750,000. So we are geared up now with a designation by CFA of $672,000 that allows the camp season to open up as large as they can with full staffing, and we'll see where the registrations fit for camping. So we want to make sure that we have the ability to open up camping as much as possible. Trustees have been working through some of the loans that they have. 13 struggling churches have had deferred loan payments until July 2021, a couple more months. That's been since January of this year. Those churches comprise about 50% of the conference loans with the trustees. And the Board of Pensions is pleased to be able to say that they've just recently taken action on the HealthFlex rates going into 2022. Even though Westpath processed a 5% increase in our premiums for HealthFlex in 2022, the Board of Pensions is convinced that they want to just hold flat at our current rates for both the church and the participants in 2022 to lend a helping hand on that financial struggle. And Bill, the last one that I have is probably the biggest rock that we have to upend as we are in search for where do churches go for the financial support in 2021. I'm pleased to be able to say that I believe this is going to be an opportunity that is open to a lot of our churches, but because it's a complex avenue, I want to make sure that we're doing this justice to make sure that you know what's involved. I'd like to teach you a little bit on this video to be able to tell you a little bit more of how you actually apply for this credit. We've introduced this once before back in February as being an opportunity for churches. But I do think that this is one that we need our churches to really gear up on. If your treasurer is not on this webinar tonight, I want you to make sure that the treasurer gets exposure to this webinar so that they can hear a couple of these slides. So I have about 4 or 5 slides to go through the details. This credit is called the Employee Retention Credit. It is processed on the IRS quarterly Form 941s. And the 941s are essentially how your lay employees of the church, how they allow their participant contributions and the church contributions to Social Security and Medicare. This is how those reports are made each quarter as you're providing money to the IRS that's been collected from payroll and also contributed by the employer. Because clergy are not in a tax status where they are having those Social Security and Medicare taken out of their pay, and the church does not pay a contribution towards that, the clergy pay is not eligible for the employee retention credit. So what we're going to be doing is, first of all, determining our churches eligible to get this employee retention credit. And there are 2 categories that the IRS has identified: a shutdown test or a gross receipts test. It's very simple for churches. Because you had government authorities who actually did a partial or full suspension of the operations, the worships at churches, all churches meet this criteria to be able to qualify for this employee retention credit. It is in comparison then that you are also told that there is a gross receipts test for other employers who don't necessarily have that governmental authority that suspended operations. But just know that these are significant drops, 50% drop in gross receipts, 2020 versus 2019, and 20% in 2021. So this is intended to be a significant help to those organizations that qualify. I would say that because of the complexities, I used to give the impression that this might need professional assistance to be able to take advantage of this credit. Just know that I believe that the guidance here from Westpath, take a picture of the screen if you'd like to be able to get access to the Westpath guidance. These slides will also be posted for your access. And there's some good videos that introduce this. And I believe that if you are one of the treasurers who's doing a manual input of your 941 data, I'd love to be able to work with you to be able to get you to do this employee retention credit without any professional assistance. So you just use mine. So we'll learn it together and we'll walk the churches through. We did this with PPP. I think we can do this with the ERC. Bill, let's go to the next 2 slides. So these are some quick pictures of what does the employee retention credit entail. First one is that there's eligible wages that are being applied, and they're going to start at the very beginning of the pandemic, March 12th of 2020, and they're going to continue all the way till June of this year. That is 6 quarters essentially worth of data that's going to be out, and we're going to qualify what are the eligible wages that you have for your organization. And I'll have a sample example here at the very end of this, and where I'm going to walk through a church that just has a pastor and an administrative position, and we'll see how simple and how how large these retention credits can be. But the eligible wage is a combination of your salary and health benefits for these lay employees, and it excludes any of the contributions that were made from the PPP towards their wages in 2020 or 2021. In 2020, what you do is you take all of your eligible wages for each one of your employees. 50% of those eligible wages are then eligible to be a credit on your 941s. It's maxed out once you get to $10,000 of eligible wage for each employee. So each employee up to $10,000 of eligible wages in a year, 50% of that, in this case, 50% of 10,000, you're eligible for a credit of $5,000 per employee in 2020. They made this a much richer benefit in 2021 when they increased the credit to 70% of eligible wages. And they also changed the threshold to be $10,000, not per year, but per quarter. So now you can actually put in $10,000 per quarter, 70% credit. That's $7,000 per employee per quarter. And for the 2 quarters in 2021 that they're going to be qualified for, that's $14,000 per employee for 2021. You get to combine both of these years, $19,000 per employee. And for many churches, they will find that this is a richer benefit than what was actually given to them during their PPP formats. This is the big helping hand. I believe that this is the reason why PPP 2 is exhausted and may not be reestablished for churches. So this becomes the avenue for churches to be able to gain access to additional support through the 2021 recovery. I've drawn up the table down below. You can see this at your leisure in viewing this webinar later, but I do believe that there are good tools for being able to just lay out for an individual, when did you pay them through the church? When did you pay them through PPP? Identify which quarters they are, and that will all become meaningful when you're putting in your applications for the credit. Now, Bill, there's 2 forms that I want to be able to introduce. The first one is the standard. This is your form 941. And Bill, I don't know if we can get that a little bit larger, a little small on my screen, but let's give it a shot. I'm simply going to tell you that in the 941 form, there is a worksheet that comes in on the 941 instructions. It's called worksheet number 1. That worksheet number 1 gives you 2 lines in the old traditional 941. One is called the non-refundable. This is that top one, 11C, non-refundable portion of the employee retention credit. And that worksheet is also going to give you a 13D, and I'll read that out to you. So that's a refundable portion of the employee retention credit. When you do the calculations on this, what you're actually getting is a refund of your employee retention credit on your quarterly form. It's going to end up giving you an overpayment down at the bottom. And in that line, in the very small blocks down in the bottom right, it's going to tell you, would you like your overpayment to be paid back to you in a check, or would you like to apply it towards future 941 obligations? So it's a great thing to be able to say that you could get the money today after you do your 941 report for whatever credit it is. And in many places, that credit will actually be more than what you actually paid on your 941. So it's actually a very big supporting hand from the federal government towards a church's livelihood. Bill, the next form will be finished here quickly. The 941X is what you do to amend any 941s that have already been put in place. So it started back in the Q1 of 2020. We're already 5 quarter statements already into this program. So in any of those prior quarters, you're going to do a 941X. And if we go with the standard verbiage in the 941X, you have up until 3 years from when you filed the original 941 to make this claim. I'm not willing to think that that can't change in time. So I think that this is something that their church would want to do over the next 3 to 4 months, to be able to go back and put in 941Xs to claim their credit. But just know that right now you would say that you have 3 years to be able to do that. The 941X is also going to be changing in July, and that will impact any kind of adjustments you do in that second quarter of 2021. Here's the eye-opening slide. The next slide tells you what this example is for a small church that has one full-time pastor, one part-time administrator, and you're going to pay the administrator $20,000 per year with no health benefits. So $20,000 per year, no health benefits, and you receive $3,000 in PPP in 2020, $3,000 in 2021. And once again, the pastor's compensation is not part of this equation because it's not eligible for the ERC credit. So we know that we qualify because of the shutdown test. The 2020 gets a calculation. That 20,000 from March 12th to December 31st is about $16,000. You subtract off the $3,000, you have qualifying eligible wages of $13,000 for that administrator. That's above the threshold for 2020, which was set at $10,000 per year. So we're going to calculate the 50% credit for 2020 on that threshold amount, $10,000. That gives you a credit of $5,000 for the year for 2020. You do similar processes then for 2021. And you're going to do this by quarter because the thresholds are set at $10,000 per quarter. The first quarter gives you a total credit of $3,500 using the 70%. The second quarter, because there's some PPP involved, is less, and the credit becomes $1,400. So in this example, one church, one employee part-time paid $20,000 per year. The employee retention credit is $9,900. And it would require the church treasurer to go in and supply a corrective amended 941 for the quarter 2 and quarter 1 of 2021. And they might have to do 2 quarters in 2020. So about 4 amended returns on the 941 would reap the value of the 9,900. Once again, if you max these out, it's $19,000 per employee. Bill, that's my presentation for tonight. I would just simply put the last slide up and say, this is going to be an area where we all grow together. We continue to do these consultations. We've learned a lot from each other as we've gone through these imaginations with the finances. We'll continue to do that. This is the link for doing those consults, and I really look forward to being able to help you and the churches through this. I extend that from everybody who's part of this team. That's Pierre McPayton and Francis Tego. Frank Robert is on this list as well. And we also have Dave Scholler and Kayla Spears that do a lot of work in consulting with churches in this area. With that, Bill, I'll turn this over to Melissa, who's going to wrap us up with a little bit on communications.
Thank you. That was fascinating information. I'm going to make the communications quick. I just want to share with you all, in this time of transition, I think it's going to be essential for churches to take a saturation approach to communications. You're going to want to share your message in as many ways as you can with as many people as you can. During the past year, most of our churches rose to the challenge and were really creative about reaching out and communicating with their members and their communities. And it's essential that this creativity and innovation continue. I know everyone's tired and it feels like time to exhale, but this is also a time for you to make sure that you continue to reach out and embrace new people in new ways. It's also time for you to look at the way that you did learn to communicate last year, how you learned to use video in new ways, and how you learn to use Zoom, and decide which of those ways were temporary and which of those ways do you really want to embrace that could be transformative for your church. The common theme I'm hearing in a lot of the church's messages is welcome home. But I want you also to take some time to realize that not everyone's thrilled about the reopening that's before them. Some people are anxious, some people are uncomfortable, and some people are carrying a lot of loss and grief with them. I think the church has a unique voice to speak out to these concerns and to help people reflect upon the pandemic, but also who they want to be and the faith that they want to claim as we move into the season ahead. The United Methodist Communications has some great resources to help you. There's on the chart, there's a whole series of postcards and downloadable and shareable resources around the theme of It's Time. This resource has been really, really popular. There is a discount for churches of $350 off the postcards, but they're quickly running out of money for this because of the response. So if you're interested in getting the postcards, I would urge you to apply for the promotional code as soon as possible. When you go to this site that's in the chat and on this slide, there's a thing called campaigns. There's a campaign that is called Let's Find Hope Together. And it's a whole nother set of resources that your church will want to check out. We only have a few minutes left. I want to assure you that we're going to be looking at all your questions, putting together an FAQ on the website for you later this week. But Bill, if you want to take it away, if we have time for one or two questions, or
we have time for one or two questions, but I'm glad that you mentioned that, Melissa. Just so there's no doubt, this is being recorded. It will be available by week's end. The PowerPoint slides will be available by week's end. An FAQ will be available, because you all are asking some great questions that we just can't get to all of them. But one that I want to just lift up, because for a lot of people, they've been in isolation for this year. And we have one participant who is asking about some mental health resources. And what can we say to those who are just really struggling with their mental health issues because of the pandemic?
Thank you, Bill. That's so important. And Francis shared with us some resources that we know we have available to individuals within our annual conference. And while it may feel like we've spent a lot of time talking about risks and how to avoid risk, that's important, and we need to be sharing that information. But we also know that this has been a time of immense loss and grief for individuals who yearn for in-person contact, who yearn for in-person community. And so we ask our Reentry Well task forces to balance that as you are making your decisions. How can you increase and encourage groups to gather, encouraging those who have been fully vaccinated, who are willing to come back and be a part of in-person Bible study, other kinds of in-person gatherings. There are persons who are suffering greatly from the lack of that human contact. So yes, there are resources available to help us with our mental health, and that is as important as we treat our physical health. Our mental health needs to be addressed as well. And we encourage you to begin to invite groups back, especially those who are fully vaccinated, who can gather at very low risk to themselves, to be able to be present for those yearning for human contact. Francis, what else might you add to that conversation?
I'm trying to unmute myself. I'm sorry, Bishop. Yes, thank you. We also have, I think you just mentioned the EAP for clergy that are people on our HealthFlex, our HealthFlex plan, that they can use these resources that on the EAP and also the Wellbeing program that we have on the Virgin Pauls to be able to help them. And we know there are other resources for mental health within the county, you know, and states that we know we're not just talking to clergy, and we also know we have congregations here that they could take advantage of. Thank you.
Thank you so very much, Francis. I think the rest of our questions can be answered very well in the FAQ. So please, again, later this week, if you go to www.bwcumc.org, we'll have the recordings, we will have the PowerPoint presentation, and we will have an FAQ available for you to look at later this week. So I want to thank our panelists for joining us tonight. This is a lot of information, and it's a lot of very important information. You all handled it so well. I know we can't get to every single detail that some of the people are asking us about, so we do encourage the your local reentry well teams at your local church to wrestle with these and to come up with your answers for your context. But please refer to all of the guidelines that are being provided in tonight's webinar. So again, thank you all very much. I would like to invite Reverend Tony Love to close us in a word of prayer.
Thank you, Bill. Will you join me in prayer? Awesome God, we pause to give you thanks for this evening. For all that has been shared, expressed, and realized, we offer appreciation and gratitude. Grant us wisdom for the living out of these challenging and often confusing days. Order our steps and our minds and our wills, that we may do all that is pleasing in your sight. On behalf of these, my siblings, I ask you, God, the God who released the Holy Spirit full and free upon your children, in this season, equip us to walk in wisdom and knowledge with full discernment as we grapple with determinations and decisions. May we do so with grace and fairness. Empower us, laity and clergy, conference staff, to use our giftedness and grace to bring about healing and hope, care and concern, joy and rejoicing as we advance your kingdom. And may we do so with compassion and humility. Embolden us, your daughters and sons, servants and disciples, to live in the strength and the might of your Spirit. And may we do so with love and respect. Now, God, as we close out this evening, as we move forward and we move out, may these words still ring true in our lives. They will know we are Christians by our love. Let us love as you have loved, even when it cost us something, or even it may hurt. In Jesus' name we pray. Hallelujah and amen. Back into the hands of our webinar wizard, and that is the Reverend Bill Brown. Thank you so much for your leadership this evening.
Thank you so very much, Tony, and thank you to all of the panelists for joining us tonight. Particularly thank you for our participants for joining us this evening and for providing such wonderful questions. Have a great evening until the next time we gather again. God bless.